everybody. Welcome back to another Focus on Business. Now, this next person that we have on the show tonight is awesome. I've known her for, 24 years. So I met her when she was little, right? So, but now she pokes you. It's a good thing. Not a bad thing. It's a good thing. So this is Miss Stephanie Corey. Now, I know her as a different name, but it's Stephanie Corey. And she is the owner of White Crane Clinic.
Yes.
And it's really good because a lot of times we have people come on the show that they'll name their business and you go, okay, what do you do? White Crane Clinic. Kind of that Asian medicine, acupuncture, and there's a whole lot more. So we're gonna kind of get into this.
Perfect.
So the first question I have for you right out of the gate before we tell everybody who you are is how did COVID affect you?
Yeah, so COVID was a very interesting pandemic for a lot of people, but we were very fortunate because we do a lot with the VA. And so for the veterans, we are pain management.
Nice.
Yeah, so for us, we were able to stay open because we were taking care of pain management for so many veterans. It definitely slowed down our business. We definitely needed to kind of take our schedule and bump that further out. So we were really good about having one patient in at a time so that no one was crossing. We clean and do a ton anyways because we are a medical facility, but we did a lot of that, a lot of laundry, but a lot of cleaning. It definitely did affect our business, I would say probably by about 50%. And so now, really in June, we started to see that come back up. And then, of course, being in Florida, and July happened. And so we've seen that go back down a little bit.
Right.
I'm very fortunate and very lucky that I've grown up in this community. So I have a great community behind me. And I've prepared for these types of things. Now, normally our preparation is for hurricane season.
Yeah, right.
Not for something like this.
Exactly.
But it does happen. So it definitely affected our business. I know a lot of other physicians were shut down. We had to transition to doing online and telehealth. And so it was a struggle, but it's been a great learning experience. And it's actually opened a lot more doors to what other possibilities are out there that we never explored prior to a pandemic like this.
Right.
So if you think about the positives of that, it's definitely expanded what we can do maybe into the next year, hopefully once this is over.
That's awesome.
Yeah.
So now that we got that out of the way, because I guarantee you everybody there's like, okay, so now let's talk about what is the White Crane Clinic?
Okay, so the White Crane Clinic has been around for over 30 years.
You're not that old.
I am not that old. No, I'm very fortunate that it's a good family friend. I was in nursing school, hated it, and changed into doing acupuncture. And of course, ended up loving that. So I was very fortunate to be able to work for him now a little over 10 years.
Wow.
I've been working for him on and off.
Right.
It's kind of wild.
Which he's awesome because he worked on me and your dad.
He did. Yes.
Yes.
He's been in all of our lives for quite some time.
Actually.
Yeah. So I'm very blessed to have him. But yeah, the White Crane Clinic offers acupuncture. We do massage therapy. We do other energy work, such as body code. We even do art therapy. So we've definitely expanded from just acupuncture.
Right.
Many, many years ago.
Now, is it acupuncture and acupressure or just acupuncture?
No, so what's nice about what we do is we're really different than a lot of other acupuncturists around. So when you go to school in the United States, you learn Chinese acupuncture.
Okay.
You might learn a little bit about others, but really Chinese acupuncture is what you do. Acupressure goes along with that. The points are all the same regardless of what Asian style of acupuncture you do.
Okay.
But what we do is we do Chinese acupuncture, Japanese acupuncture, Korean acupuncture, acupressure. Yeah. So what's nice about what we do is if one method doesn't work for somebody, then we can look at some other alternatives because there is no one way, right? What works for you may not work for the person who comes behind you. So we're very fortunate that we've had all of this education, most from Dr. Sullivan, who studied in Korea. And then I specialize in Chinese and Japanese. So it entirely depends on why what we'd use.
Let's actually break down what is acupuncture.
Yeah. So acupuncture is the use of these small needles. They're hair-like. So if you've ever given blood or had an IV done, right, anything like that, 15 to 20 of our needles fit into that one.
What?
Very tiny, very thin. My youngest patient is 5. He plays on a phone the whole time. My eldest patient is 95. completely different reasons as to why they come in, but it helps for both of them. So what we're doing with the acupuncture needles is we're sticking them in very specific locations and acupressure points or acupuncture points to generate a specific response from either tissues, body organs, hormones, glands, those kinds of things. So what we're doing is there's definitely a science to it behind it. It's not just it hurts here, stick a needle there. Right. So there's definitely a combination of points. So that's why we're able to really work on such a wide variety of ailments.
So I have my arm is hurt, right? You're not going to stick it in my arm right away. You're going to find the points that actually work on the arm.
Work on that, right? So if you had injured yourself, right, and your arm is, you're doing something
stupid.
Yeah,
That's
I didn't want to say that, but
nope. That's what we do. We're guys.
So if you were doing something like that, there may be a few points that we put in there for acupuncture. We might do some mucks and some things like that. But in the whole healing process of that, I want you to feel better, but I want you to be getting better too and healing faster. So my job is to help lessen the inflammation, promote the circulation to that area, and get things to move to heal the entire body. Because if your whole body is acting like that, there's pain, that there's inflammation, you're going to get inflammation everywhere. So my goal isn't to chase things and say, okay, we fixed this. Now let's work on the sleep issue, or now let's work on the stress.
Right.
We work on everything at the same time, but that's how we effectively create change with pain. Pain, I will say, is 70% of what we treat, and probably the easiest thing for us to treat because
Okay,
you
I have
can
a question.
say, sure.
What's the weirdest place to put a needle that controls the furthest piece of your body? I threw a curveball. Sorry.
Yeah, actually, so it's for a toothache.
Really?
Yeah. So if
Okay.
you have a really bad toothache, and actually even heartburn, the best point is on your foot, in between your second and third toe. So right where it meets the foot.
The very bottom controls the top.
Yes. So that's one of the best points for a toothache. Yeah. So that's kind of an odd.
I've never heard that.
Yeah.
Wow.
Yeah.
And all you guys thinking out there exactly the same thing I'm thinking. There's no special point for that special thing, and I'm just get it out of your head now. Just saying it.
I will say anything you can go to a primary care doctor for, you can actually come to us for.
Really?
So we treat everything and anything. So I know that's kind of an odd thing to say, but that's why digestive disorders, infertility, headaches, anxiety, insomnia.
So I have acid reflux really bad. I've been on medication for like years.
Omeprazole?
Huh?
Are you taking like omeprazole?
Stopped working.
Okay.
I had to ultimately I had to go to, believe it or not, I do Nexium 24 hour now.
Okay.
Because other stuff got so crazy expensive. I'm like, let's go get Nexium. And I take 2 of the 24 hours.
Okay.
Every day. And I've done that for 15 years.
Yeah, longer than you should. Okay.
Yep. Right. I probably don't have an esophagus anymore.
Yeah, I'm sure there's some issues.
But I also, so that you can treat stuff like that.
Yeah.
With acupuncture.
With acupuncture.
That is amazing.
Yep. Acupuncture, Chinese herbs are a big part of what we do as well.
I always thought that acupuncture was like, I thought it was just nothing but pain. So if you're in pain, go see them. You know.
Yeah.
I mean, growing up, I was a martial artist. I fought a lot. I think you guys all knew that. And one of my senseis was just little Chinese dude that every time I got hurt, he would say, "Come here, sit down." He would do them. And then he would, it's going to sound stupid, he wouldn't do the heavy clap. He would warm his hands up because you need that heat, I guess. And then he would do things and I'm like, oh, hey, that's pretty good, you know? So I knew it was a good thing. I just didn't realize it went further than that, which is kind of cool.
Yeah, it's really neat.
Wow. Okay. All right.
Wide scope of practice.
Do you have, it is very broad. Yeah. So, does insurance, I mean, I'm going to ask you a dumb question. Insurance cover it?
So it depends on the insurance. So veterans, the VA does cover acupuncture entirely, acupuncture and massage for veterans.
They like that.
Yeah. Wow. So they've started doing that. That's been a great program. With a lot.
Back problems.
Yeah, usually it's for pain. We do a lot of the pain management for VA.
I know my TD back here in the back. Yeah, he could use you.
Yeah.
Because him and I both, we're like two twins. And his back hurts or my back will hurt. And we're like, yeah, what do we do to ourselves?
Yeah.
You know, I'm getting old, I guess. So you do acupuncture and of course acupressure. Now what else does the clinic do? And we're going to dive deeper into some of this stuff, but I just want to get the generalities.
Yeah, we do massage therapy.
Okay.
So that will include craniosacral, myofascial release, those kinds of things. So depending on what you're coming in for.
Okay.
We do other energy work like Reiki and body code.
Oh, you do. Now, what is body code? I've heard that twice this week, and I kind of I think that I'm pretty smart, dude, and I've worked with a ton of industries, but I don't know what body code is.
Yeah, so body code, actually one of our massage therapists is the one who does that. So it's really about listening to the body and asking very specific questions and eliciting a physical response to those questions. So it would be similar to some people will do muscle testing. It's similar to that, but you're actually asking about specific organs and diagnosis and treatment. So it's a very interesting type of energetic work. Yeah.
So
we do that too.
I mean, we got about a minute and a half really quickly to get, how long is that first session to come in and go, hey.
For body code?
Yeah.
An hour is
So you have
an hour is usually good. Yeah. And if you're doing follow-ups 30 minutes, you can do, but an hour is a pretty good amount of time.
What if you walk in like me and go, okay, everything hurts. I don't know where to start, just wherever you want to start, you know.
Yeah.
And sleep. I heard you guys said something about sleep.
Sleep is a big thing. Yeah.
Is it? So you can acupressure will help, or is it the body code and
it's a combination. It depends on why. So there's so many different reasons why somebody could not sleep.
So much to talk about because I hurt, don't sleep. I'm old. So yeah, it is what it is. So, okay. So we have let's put our website up real quick. This is your website. And this is, that's pretty.
Thank you.
Really, who did that?
Not me.
Not me. Yeah, it wouldn't be me either. Very, very nice. I like
you.
that. And so you do herbal. And we're going to get into the whole herbal side because that's a rabbit hole that we could probably never come out of. It's really, really deep. And Reiki, I do know what Reiki is.
Yeah.
And then there was this. Do you use the mats or the? There's something that does the NASA. It's a beamer.
Oh, we do not use a beamer.
Okay.
But we have a biomat, which is similar to that. But we actually don't use a beamer.
No, how about that? Sorry.
Yeah, there you go.
So okay, everybody go freshen your coffee, tea, wine, beer, drink, whatever it is you got, and come right back because Miss Stephanie's going to really kind of teach us some really cool stuff. We'll be right back. All right, this week we're going to talk about something exciting as usual.
We always have something exciting.
Yes, we do.
At least it's exciting to us.
But this is a question that comes up.
TV, hey, it is Friday night. We're not here. Yes, we pre-recorded once again because WeBeam TV is working over in Tampa with Dancing with the Stars.
62 Who Knew. I almost said Professional Mortgage Alliance, Joe's Bar and Grill. But actually, it's our 39th week of 62 Who Knew.
We're at the wonderful steampunk event at the Verizon Event Center here in 2019. I think it's still August, right? Yeah. Woo! Can't remember. I skipped about Florida law.
Yes.
To be able to help businesses to do that part of it. But it's just been a couple of years.
Well, and I've taken the business card files from our business cards.
Entrepreneurs and professionals of Tampa Bay, welcome to your hour for getting the information, the tools, and the connections for
Battles on Radio Influence.
Or you say left hand white, and then they catch the left hand white. What it does, it helps you quick with hand-eye coordination. Yeah.
Well, that's kind
as your super connector. We want to introduce you to our 50-plus show partners. We got over 80 categories of expert contributor advice here on the Consumer Quarterback Show, and we want to.
That's where we disagree, but that's okay.
I said nonviolent.
That's okay.
Because, you know, we're one of the only states that don't give them back to life. Got Jamie Limbaugh. He is from the Next Step Image. I love that name because you were telling me earlier.
For the type of republic we actually are is actually very correct. Yet politicians and regular people use these words interchangeably, even though technically they are very different.
If you're an overdoer, overachiever, people pleaser, we tend to neglect ourselves. And even as Sisters Connected here, you know, with Women Unscripted, I know.
Okay, we're back. And guess what? We're going to talk about herbs. Not what you're thinking. I know my crowd. You don't think that way. Well, you can if you want. I don't care. It doesn't matter to me. So, but now, Miss Stephanie, I call you Miss Stephanie because I didn't call her Stephanie, but because I've known her forever. But I call her Miss Stephanie or Doc. Hey, Doc, how you doing?
There you go. I'll take that.
So let's talk about the herbal side.
Okay.
Because, there's an old movie that everybody watches called The Golden Child. It's got Eddie Murphy in it, and he goes a little Chinese, and he goes, there's some yak loin. And I'm like, he goes, what's that? He goes, keeps your yang up. And I'm like, oh, no, I don't want that. But there really is a very serious side to the herbal side. Correct?
Yeah.
Let's talk about some of that you do, because I'm interested, because especially if you can help with sleep, because Ezekiel's about killing me. But I know she's like, oh my God, I can't believe
It
you
hurts
said
my
that.
soul to hear that. That and the Nexium are killing me.
It is. It probably is.
Probably.
And it's probably why I can't sleep. So let's talk about the herbal side.
Okay. So what's great about, we have a full herbal pharmacy. So that's really what's great about our office and what makes us a little bit different.
Okay.
So we have liquid formulas, we have granular formulas, we have capsules and all different kinds of things. And we even have raw formulas, and we can custom make things.
Wow.
So yeah. So that's really a nice option for our patients when they come in. Now, I will say most people fall, because we have so many tinctures and capsules and granules. Normally, we have something on hand that we can give them.
Right.
So having to create a formula would be a very specific.
Now, when you say
instance.
create a formula, that's like going back there, getting it all together, grinding it down in a little pedestal thingy, and putting it in the capsules and all that kind of
Yeah, you can do it that way. We can take individual herbs that have already been done into liquids and actually then combine and make formulas. So for something like this pandemic that we've had going on, right, we've been able to actually custom make formulas for that. So troubling cough, dispelling, pathogens, those kinds of things. So when something like flus, right? Flus change every year.
Yeah.
So, and that's why you need all these flu shots and all these other things. But what's nice about what we do is we're able to take the same data and research that's used for coming up with a new version of the flu shot for us to combine and create a formula for our patients to utilize during that time. Yeah. So it really allows us a lot of flexibility. So you mentioned sleep being an issue for you.
Oh, yeah. 4 hours a night, if that.
Yeah. So there's a lot of different reasons as to why someone could have struggle falling asleep. It could be because they're unable to turn their mind off. They have so many things going on. They just can't stop thinking. So, right. So is it more related to stress? Is it anxiety? Is it harder? Do you have more trouble falling asleep, or is it staying asleep? Do you wake up at a very specific time? What time do you go to bed? All of these things come into play. So we ask a lot of questions about that. So all of that, including even some digestive things, will have an effect on that too.
Okay.
So there's a lot of things that really go into play when we're talking about an herbal formula. So it's different than if you have, heartburn and we say, okay, Nexium or Prilosec or some type of omeprazole, any one of those. But it's different because, again, the reason someone could have heartburn is because they either have too much acid, which is what most people assume, or actually because they have too little acid.
I knew that.
Yes,
I do.
look at you.
I have literally done the test where I went to my doctor and he said, okay, drink this. And I'm like, okay, what is it? He goes, lemon juice. And I'm like, why? That's going to kill me. He goes, just drink it. And I did, and it did. It killed me. He goes, okay, well, you got too much acid. Because he goes, if you drank it and you didn't have a problem, you just don't have enough acid, and your body's working overtime to try to, I've heard. Now, I know that's old school way of doing it, but that's,
actually, I'm surprised that he did that, because many times when somebody goes in, they're just thrown a prescription or, just go take something you can get from CVS.
We worked on diet, and we worked on, he did blood pulls and the whole 9 yards. I had to swallow the little thing that sat down in there for a week to track everything. Yeah. So
that's pretty amazing.
Yeah.
He's a good one.
He was awesome. He's retired now, which is really sad. I don't have a good one, so maybe I do now. But so that's just that. No, is it through a series of questions that you find out this, or do you pull blood? You do the urine and all that kind
all
of
that fun stuff. So a lot of it is done through pulse and tongue.
Okay.
So our kind of diagnostic tools that we use for
What is
traditional
that?
Chinese medicine. So we feel pulses. So when we're feeling a pulse, we're not just looking at rate of pulse. We're looking at, you can actually feel specific organs and how they're functioning and all of those things. From
Really?
Yeah. And in your tongue, we look at the size, the color, the shapes, the cracks, the coating. All of that gives me a really good indication as to why you have these issues. So we utilize that. However, we are maybe a little more Western in some of our thinking, or we've moved that way over time because patients have really requested that. So we actually are able to send out for blood work and x-rays and MRIs. I mean, like I said, we're just like primary care.
Okay.
Yeah.
All
So
right.
we do all that stuff too.
Wow. Okay. So let's talk about the I know it's a broad question, but the broad scope of the types of herbals that you use.
Yeah. So really, it's such a huge scope.
I know.
So.
It's like I'm asking, like,
That's okay.
So tell me about baseball.
Yeah. No, it's really interesting because when you think about it, because we have, and I can envision our herbal pharmacy right now, so many things. Herbs are great for some things versus acupuncture. Typically, it's the combination, but there are some things that work best with acupuncture and something that are really great for herbs. So I mentioned before that we do a lot with fertility.
Right.
So when we're talking about fertility for a female, acupuncture works great if they're having issues ovulating on one side, those kinds of things. Acupuncture works great. But truly, to get hormones balanced, especially if it's a male infertility issue, herbs are a big part of that. So it just depends on what they're coming in for and why. But we have a pediatric line as well. We do a lot with kids too. So yeah, we really kind of see it all. Anxiety is a big one too. Anxiety and depression. That's a big one right now, especially with
the COVID
life
thing.
and everything going on. So
like, I'm stuck at home.
yeah, so that's a lot going on. Mental clarity, changes in jobs. So there's a lot of stress that we deal with, and herbs are really great for that. Herbs, supplements, CBD, which is a whole different thing.
So do you handle the CBD world?
We do.
Okay.
We're very picky about our CBD. And the reason I say that is because you can get it at the gas
Walmart,
station.
7-Eleven. Here.
Which is kind of mind-blowing. But you have to be really careful about what you're using.
Right.
And actually look at the ingredients to see if there's actually anything in it.
Got it.
Which is probably the number one thing.
So I'm gonna hopefully I'm gonna make she'll go. Oh damn, John, that's gotta go. So it's the best is cold pressed.
Okay.
And then it's got to be grown in the cleanest soil you can get a hold of. I mean, it's got to be a moist soil, not a dry soil. And typically it is grown. We used to do it. We had multiple CBD shows. So and they just never last. I don't understand why. It's because it's a great subject. But am I close?
Yeah.
Okay.
So you have to be really finicky about where you get it. So some of the ones that are the best, you're going to find out more from the west side of our beautiful country. So
California, Oregon,
Colorado,
Washington, Colorado. Yeah.
Those are some of the best. However, they're also some of the most expensive.
Right.
So the two top CBDs are actually grown out there, but they're incredibly expensive, and really most people in our community are unable to afford those. So we have done a lot of research. So the third best is actually grown in Kentucky. I know.
Good old Kentucky.
Good old Kentucky. And I have, family members from Kentucky.
I was going to say, you got family from there, don't you?
I do,
Yes, you do.
So Kentucky, they grow the third best CBD product.
Really?
Yeah, which is kind of shocking. And so that's what we utilize because they're able to really make it affordable.
Right.
And I will say, and I probably shouldn't, but I was not a big CBD believer before Dr. Sullivan and I did a lot of research, him in particular, about it before we carried it. And I said, well, I'm going to try it. And I was actually shocked. So we have it in a tincture and capsules. I prefer the tincture. It's easier for people to absorb.
Drops on the tongue.
Yeah.
Yep.
But the other thing is it's really great in a roll-on and even as a cream. So we use it. Yeah, it works great. We usually carry it around in a purse or a bag.
Can you talk about who you're using?
Which product we're using? Medterra.
Medterra? Okay.
Yeah.
Yep.
So we use Medterra, and we really like them. They do such a great job. They have more and more products that are coming out. So I know there's gummies and that whole thing, but really the topicals is what we use a lot, especially for veterans, because it really helps with the pain.
Yeah, because I've learned that we are born with cannabinoid receptors, that have back in the day when the Indians and all the they were eating the animals that had already eaten the marijuana plants, and they were getting that through their intake of food, and that was actually keeping them out, or they would go smoke some peace pipe.
Probably a nice combination of the two.
Right, and it actually healed us. In today's society, we got away from this whole really good world, and now they're making all these fake drugs that go in and confuse your receptors, and it's like, and then the minute I know a lot of people that have gotten completely off of their medications and gone to the true marijuana side and the CBD, and they're just so much healthier now.
Yeah, I think that because our food, our sources, the way you're getting food in a grocery store has all vastly changed. And even if it is organic, which is better, there's still a struggle. So it's definitely caused a lot of problems. So that's really where herbs and things like that. I mean, it's sad to have to take supplements at this point in time, but that's really where the world is turning to because they're not getting it from your food. You're really not getting a whole lot from food.
So if you close your eyes and look at your your I don't want to call it dispensary, but your Chinese herbs,
Herbal Pharmacy,
It's vast, isn't it?
It is. It's huge. It's huge, and what we're able to do with it is kind of mind blowing. Everything, like I said, from pain, which is one of the easier things, to Parkinson's and type 1 diabetes and gastroparesis, which are diseases, digestive disorders that even Western medicine struggles with. So that's really what I love, is that we're able to help patients who have been told by Western medicine that there's nothing else they can do.
Amazing. So when we come back, we're gonna talk to Doc Stephanie here about, your dad was telling me something about the immune boosters and stuff like that, and then that to me is awesome, because the older I get, it seems like the little more scareder I get about what's rolling down the pike, and I don't like that. And let's make sure that we got her information up again one more time, if you don't mind, or Rob. I cannot wait to talk about this, because he told me he did it and has felt great ever since. I mean, he's always he's like a horse. I mean, the dude just don't ever stop.
He's definitely going to outlive me.
I worked for him a long time ago, and let me tell you something. There's no, even today, I don't think I could outwork him. So it's just, and that's just from being good stock and heavy, a healthy guy. So again, grab some coffee, tea, drink, whatever. Come back. We'll be right back after these messages.
All right, this week we're going to talk about something exciting as usual.
We always have something exciting.
Yes, we do.
At least it's exciting to us.
But this is a question that comes up.
TV, hey, it is Friday night. We're not here. Yes, we pre-recorded once again, because WeBeam TV is working over in Tampa with Dancing with the Stars.
62 who knew. I almost said Professional Mortgage Alliance Joe's Bar and Grill, but actually it's our 39th week. 62 who knew.
We're at the wonderful steampunk event at the Verizon Event Center here in 2019. I think it's still August, right? Yeah. Woo! Can't remember it.
To be able to help businesses to do that part of it. But it's just been a couple of years.
Well, and I've taken the business card files from our business cards.
Entrepreneurs and professionals of Tampa Bay, welcome to your hour for getting the information, the tools, and the connections
Ian
for
Beckles on Radio Influence.
Or you say left hand white, and then they catch the left hand white. What it does, it helps you quick with hand-eye coordination.
Well, that's kind
As your super connector, we want to introduce you to our 50-plus show partners. We got over 80 categories of expert contributor advice here on the Consumer Quarterback Show, and we want to.
That's where we disagree, but that's okay.
I said nonviolent.
That's okay.
Because, we're one of the only states that don't give them back their right. Got Jamie Limbaugh. He is from the Next Step Image. I love that name. because you were telling me earlier.
For the type of republic we actually are is actually very correct. Yet politicians and regular people use these words interchangeably, even though technically they are very different.
If you're an overdoer, overachiever, people pleaser, we tend to neglect ourselves. And even as Sisters Connected here, with Women Unscripted, I know
All right, we're back. You know what? I'll tell you what, this next topic is, I don't like injections, but you guys have a whole line. Your place that you have 2 studios. I mean, well, I call everything a studio.
Yeah.
You have 2 offices.
We have 2 offices.
One is in New Port Richey and one is in Tarpon Springs.
Correct.
And we're going to get back to that, but right now we're going to talk about the injections.
Yeah.
Because you have a whole realm of that world.
We do.
Let's talk about that.
Okay. So we do different injections stemming from like vitamins and minerals, all the way to homeopathics and herbal injections. So what that means is that, yeah, we have the vitamins we inject are vitamin C, vitamin D, B12, fat burners, which is like a B6 and MIC combination. So we do a lot of those things.
Now, okay. Each one of those, or is it a combination of those?
So they are separate,
okay.
but you can combine them based on what a specific patient needs or requires.
So you can make me look like Dolph Lundgren?
Sure.
That's steroids, by the way.
Whatever you need.
Right.
And then what's great about that is we also have homeopathics, which are used quite a bit in European physical therapy offices. So for that, we would use Trameal and Spaskapril, which is for pain and spasm, for nerve pain. So alternatives to a cortisone shot.
Okay.
There's also something called Engestol, which is an alternative to a flu shot. So really it's an immune booster. So I think people get a little heated when I say an alternative to a flu shot, but there are many people who can't get flu shots because they have other diseases, nor do they maybe want to get them.
First of all, I don't want to.
Right.
But the few times that I did, those years were the worst I've ever been sick.
Yeah.
So it did exactly opposite of what it was supposed to. I got everything that came down the pike, and I'm like, that is nuts.
Yeah, and a lot of that is because what they're injecting specifically. I mean, again, it's a guessing game.
Right.
This is what we think is coming. So let's inject you with
Got
that.
it.
I don't love that idea for me or for my children. So I'm really all about boosting your immune system, whether that's through the use of the Engestol, whether that's a combination. We do a lot right now of Engestol with vitamin C and D, with everything going on right now. So there's a lot of different things we're able to do. Some people come in because their doctor told them they have to do cortisone, or they've had 3 cortisone shots and now for the next year they can't get any more. Right. That is it. So we're able to combine and create injections for them as well, which has been a really nice thing to do because injections are safe enough that they do them in small children over in Europe. And so they're really safe and really effective, especially in combination with acupuncture and herbs.
Okay. All right. So I'm going to ask a dumb question.
Sure.
Because that's what I'm really good at that. I kind of specialize in it.
Yeah, we all have to be good at something.
Because you hear, I'm getting a B shot, or I'm getting a C shot, I'm getting a D shot, I'm getting this. So let's break it down. What does a B shot cover?
So normally if you're getting like a vitamin B12, that's probably the most common injection. So B12, if you don't have any blood work to go off of, because many people don't, and now I hear you can get B12 shots at, the mall, which is, that's a whole different issue. So when you're getting B12, really energy is the big one that people go to B12 for. They just feel really low energy, fatigued, exhausted. But B vitamins are actually really great for dealing with nerve regeneration.
So what makes
that's part of that?
All right. So why can't I just go down to GNC and get me some B pills?
Yeah, so you can do that. One of the issues with vitamin B12 is the name for it is actually cobalamin. Just so you know. Yeah.
I didn't know that.
Yeah, there you go. And so when you go somewhere like even CVS, Walgreens, and you pick it up off the shelf, or you go and get an injection, what they're injecting in you is something called cyanocobalamin. Okay. And so it's just the form that it's in.
Is that a fake version?
Yeah, no, it's just the form that the B12 is.
Okay.
And so they'll inject you with it. It's really inexpensive. It's garbage.
Right.
But, and it's cheap. But what happens is there is that MTHFR gene
Okay.
I don't know if you've heard of that.
I have heard of that,
Yeah.
but I don't know what it is.
So-
I've heard of it.
Yeah. So actually about 40% of Americans have that, and they can't methylate B12.
Right.
So if you can't methylate B12, you're just going to pee it out.
Expensive pee.
It's expensive pee. And so
Right.
when that large of the community can't methylate, I have a problem with that. And I feel like as a physician, it's my duty to make sure that I inject, if I'm going to, with methylcobalamin so that it's already methylated, because I want everyone to absorb
Right.
it. Right? I'm not going to take that chance. The last thing
right.
I need is somebody going out there saying, I didn't feel anything, right?
Yeah.
So yes, it's 3 times the price.
But,
But for me, I'm willing to take that loss because my patients are getting better. So that's the difference. So when some people say, well, the mall's more convenient for me and you guys charge the same price. Well, I understand that. If you would like to go and see how you feel, and then they say it's not the same. I say, you're right. It's actually not the same.
okay.
So B12 is probably the most popular, but that's a big energy
So if you're
boosting
feeling a
one.
little run down,
Yeah.
but you're not sick, you just, I'm just tired all the time.
Right.
Okay, so what is D?
So vitamin D is really great. Usually I only do vitamin D injections if we see that somebody is from a blood work or from a lab that
Someone
they
like
have
me
a vitamin
who
D
had
deficiency.
cancer and
Correct. So that's usually, and that's really where C comes in too, because a lot of times when patients are going through cancer treatments or certain drugs that they're taking, they actually inhibits your body's ability to absorb specific vitamins from food.
Oh, B.
Yeah.
I did not know that.
Yeah.
See, learn something every day.
Yeah, you do. So it's really important for me to really pay attention. So when I ask somebody for their list of medications, I'm not just asking to cover my own butt, right?
Right.
Which I guess helps for that too. But
Yeah.
for me, it's really important to know what they're taking so that I know, okay, most likely a vitamin D deficiency is present, and then that relates back to some of those symptoms. But vitamin D acts as a steroid in the body. Yeah.
I didn't know that.
Yeah, and it actually can help with immunity much better than vitamin C can long term. So we kind of pick and choose based on what patients need in that specific time frame.
Wow.
Yeah.
Okay, so now I'm scratching my head going, all that vitamin B and C I've been taking, D would have probably been the better one to be,
Probably.
back. But
Mhm.
I was taking stuff that just gave me really expensive pee. And instead, I could have come to someone like yourself
Right.
and said, hey, this is how I'm feeling. I don't, and then you could have like, well, let's try this because I think it's going to work a little bit better.
Yeah. And then sometimes people come in for injections and we say, well, actually based on pulse and tongue, it's much more of an iron deficiency. And so vitamin C is a carrier for iron. So if I don't think they necessarily need an injection of vitamin C, they can get vitamin C that they can take, and really we'll put them on an herb to actually boost their blood production in their body. So
Wow.
there's a whole lot of different things we can do.
That is amazing. I mean,
It is, yeah.
okay, so I here I had Stephanie come in and go, and I'm like, I'm going to do a little thing with you, and I'm like, I know all this stuff. I have literally not known almost anything that you have talked about, which is to me is really cool because now I can go and guess what I learned today.
Tell Dylan.
I'm a smart guy, So okay, so we broke the B, C, D, and what's the other injection?
So we have a whole other line, which are homeopathics. And so
Right.
for that, we have Engestol, which is the immune booster.
Okay,
So
that's the one your dad likes, right?
that's the one my dad likes. Yeah, that, and they do a lot of B12. And
Okay,
yeah, I do give that's a family thing for the holidays.
right.
Spring 'em.
Everybody comes in.
Everyone comes in and listen, it's a gift for me too.
There you go, right?
But yeah, Engestol is what it's called, and it works really well, really for boosting the immune system. So again, with everything going on right now, we've used it a lot. Usually we tell patients every 6 months, like similar to what they would get if they received a flu shot. Right now, we have people coming in every 3 months for it.
Wow.
Yeah, we haven't had anyone who has had the injection scheduled, like the
Right.
way that they, if every 3 months, actually get it. We had one person who got the injection and about 4 months later ended up getting COVID, but then only had symptomology for about a day and a half, and was much better really quickly. And she even relayed it back to, it was definitely because of that.
That is amazing.
Yeah. So it's pretty incredible stuff.
Okay, I gotta come see you.
All right.
Just saying, I want some energy. I want to sleep.
You want it all.
Yeah. And that's all done in I keep going studio. It's done in your office.
Yeah, everything is done in our office besides blood work, but we write scripts for that. So blood work, x-rays, MRIs, but everything else is done in our office. Yeah.
Massage, the The
poking.
needle.
Yeah, the acupuncture, the acupressure.
Wow,
Yep.
that is amazing.
Yep. Cupping, all that.
Oh, you do cupping?
We do.
Okay, did that once.
Yeah.
That hurts.
So it
I'm like,
shouldn't, though.
Oh my God, I was sore for a week. It was horrible. I couldn't, my back,
Oh,
I
no.
couldn't sit back. Well, the guy's like, oh, come on down. I'll show it to you. Because we interviewed him.
Yeah.
And I could not, I had to sleep on my belly, which I'm not supposed to do.
Right.
And I'm like, this is horrible. I would never have this done again. So he did it wrong.
I don't know if he did it wrong. He may just have been too aggressive in his
Don't
style.
be aggressive.
Yeah. There's different ways you can do cupping. So you can use glass cups, which is where you'll actually use fire. So I'm not sure if he
I
did
was gonna
that.
say, do you turn them on fire?
So you can do that. The problem with that is that you can't control the suction. It just is going to burn out the oxygen.
He did the fire thing, and then
Yeah.
I kept telling him, there's a couple. I said that hurts. He's like, oh no,
You're
it
good.
doesn't. That doesn't hurt. I'm like, it hurts.
Yeah, it shouldn't be like that.
Okay.
You should feel like a tight. So if you were getting a massage and they squeeze your shoulders, that kind of
Yeah.
like that good squeeze.
Yeah.
That's what you should be feeling.
Oh, okay.
And it should
Yeah,
feel like
yeah,
that. So the bruises that it leaves are really just discoloration. They shouldn't be bruises
now
unless
it's purple.
Yeah. So it usually should just be discoloration because we're bringing that stagnation from that tissue. That's why you have pain
All right.
up to the surface for your body to break down.
To break it down.
So, but if you're causing bruising,
I'm not
then
throwing
that's
him
not
under
it.
the bus. And
No,
stuff.
no.
It was really cool for the guy, but I just didn't understand it.
Yeah.
And, he's like, well, you gotta try to understand it. I tried it, and I'm like, okay, I'll never do this again.
Yeah. And that's not how it should be.
And so, okay,
Yeah.
so what? Okay, now I'm like, okay, so I didn't know you did cupping. What else are you throwing at me here? I want to know, because now I'm like, I'm going to schedule tomorrow.
Yeah, we do cupping. We do needleless acupuncture, which is a really cool thing with kids or people who are scared of needles. That happens a lot.
Okay.
So that's something else we do. We do e-stim, which is like electrical stimulation. So that's a great thing to do. So a lot
I
of
do know
chiropractors do
about that. That's awesome.
Yeah, so that works really well with the needles.
Okay.
We do ear seeds. For like quitting smoking and that kind of stuff. So
Ear seeds.
ear seeds, yeah, just little like ear treatments. So we do a lot. So it's really great. Our scope of practice is huge.
Wow.
Yeah.
See, you learn something every day. Now we come back. We're going to talk about pain, true pain, right? And how they get rid of it and all that kind of fun stuff. So once again, I keep telling everybody, I have time, but get something to drink. Relax, sit back, take notes, because this is some fascinating stuff. We'll be right back after these quick messages.
All right, this week we're going to talk about something exciting as usual.
We always have something exciting.
Yes, we do.
At least it's exciting to us.
But this is a question that comes up.
TV, hey, it is Friday night. We're not here. Yes, we pre-recorded once again because WeBeam TV is working over in Tampa with Dancing with the Stars.
62 Who Knew? I almost said Professional Mortgage Alliance Joe's Bar and Grill, but actually it's our 39th week. 62 Who Knew?
We're at the wonderful steampunk event at the Verizon Event Center here in 2019. I think it's still August, right? Yeah. Woo! Can't remember
To be able to help businesses to do that part of it. But it's just been a couple years.
Well, and I've taken the business card files from our business card machine.
Entrepreneurs and professionals of Tampa Bay, welcome to your hour for getting the information, the tools, and the connections
Ian
for
Backles on Radio Influence.
Or you say left hand white, and then they catch the left hand white. What it does, it helps you quick with hand-eye coordination. Yeah.
Well, that's kind
as your super connector. We want to introduce you to our 50-plus show partners. We got over 80 categories of expert contributor advice here on the Consumer Quarterback Show, and we want to.
That's where we disagree, but that's okay.
I said nonviolent.
That's okay.
Because, we're one of the only states that don't give them back the right. Got Jamie Limbaugh. He is from the Next Step Image. I love that name. because you were telling me earlier.
For the type of republic we actually are is actually very correct. Yet politicians and regular people use these words interchangeably, even though technically they are very different.
If you're an overdoer, overachiever, people pleaser, we tend to neglect ourselves. And even as Sisters Connected here, with Women Unscripted, I know
So we're back in this last segment with Miss Dr. Stephanie. I have put that miss in there. It's just so
You have to. That's okay.
It's awkward. I don't know. Anyway, so we're going to talk about pain, right? And then we're going to talk about coverage, because that's kind of a big deal. A lot of, I know some of the people at home are going like, well, my insurance doesn't cover that. And you'll be amazed, right? So let's talk about pain. So people come to you with all sorts, arthritic, back. Let's talk about some of the stuff, some of the pain world that you deal with.
Yeah. So probably the most common would be sciatic pain. Yeah. So that's a big one.
I know exactly.
Yeah.
Rob knows about that in the back too. my TD, we're back people. So
yeah, low back sciatic pain. That's a really big one.
Yeah.
But neck pain, headaches, of course, like injuries, rotator cuff, post and pre-knee surgeries, that kind of stuff.
Okay.
Hip replacement, all of those things. So we deal with a lot of post-surgery, because if people still have pain,
right,
then usually Western medicine says, we have nothing else for you. And that's when they typically will come to us.
Okay.
So it would be great if they came before that, because
Right.
we've saved quite a few people from even getting those surgeries. But everything, ankles, if you swelling ankles, we do a lot with edema. That causes a lot of pain. So there's a lot. Gout.
I was getting ready to ask. So what if I say, hey, look, I come in and go, my leg and foot just swells up all the time, and it's not all the time. It's only after I eat a whole pizza by myself or whatever it is. That's stuff that you can handle.
Right. Yeah. So usually what we're doing is we're trying to identify if the pain is because of something you've eaten, right? So an allergy type response or sensitivity. And that's how we will treat it. So I can stick needles in your foot and make your foot feel better.
Right.
But again, if we need to get the edema down and get circulation moving to really get you better.
On.
Yeah.
Really what's going on.
To really figure out what's going on. So that's the difference. But we work really well. We do a lot with cardiologists. And neurologists and a lot of other physicians in the area that most people wouldn't think we work with.
I was going to say, the physicians like you guys?
Yes. We have a cardiologist who is amazing, who refers us a lot with edema and swelling for massage and for acupuncture. And we've been able to do incredible
That is amazing.
Yeah.
So, I'm sitting there going, I bet the real doctors don't really like these guys because they're kind of taking business away, but you really are not.
No, we work really side by side. Western medicine definitely has its place. I was in nursing school before this, so I 100% believe that Western medicine has its place. But to me, that's a last resort, right? And so it's really about finding physicians who are willing to work with you, who like that route. Yeah. And there are quite a few open-minded physicians, and most people wouldn't think necessarily in our area either. Oh yeah. There's quite a few. So we work with a lot of different physicians, which has been fantastic.
So if you've got a physician and the physician's like going, okay, I really don't want to put you on all this medication. Why don't you go see Doc Stephanie and let her take a look and go, maybe she can help you out without, because I know, it's amazing when you watch the commercials with this medication and the side effects are, well, that's worse than what I'm going through. Why would I want to take that stuff?
Yeah.
Could kill you. No, I'm good. No, I'm good. There's got to be an alternative, and you are the alternative.
We are the alternative, and
that is excellent.
Yeah, there are quite a few physicians who are willing to send patients to us, and we do the same. If something is going on, especially things like congestive heart failure, people don't notice those types of signs. There's a lot of things we can tell based on the tongue if we're approaching things like strokes and heart attacks and what's going on and how the heart's functioning. So we refer a lot to him too. And have been able to help with patients. So it's really about the combination of care. Which is why insurances and things like that are actually starting, in my opinion, to cover more. So about 50% of PPOs actually do cover acupuncture.
Wow.
Yeah.
Okay.
So HMOs do not at this point.
Now, is that a referral thing? So if your primary says, you know what, let's get you some acupuncture,
Yeah, PPOs, you don't need a referral.
No referrals.
No referral. Yeah, you will if for the VA. The VA will cover, like I said, acupuncture and massage. You will need a referral for that. But then after that, we handle that whole process. They make your first appointment, and we handle the rest
Take it
of
from
that.
there.
Yeah, we do quite a bit until you need another referral. They have it planned out. But the VA covers quite a bit. There are certain programs, like a lot of government employees have coverage that they may not know about.
Really?
Yes, especially the post office.
I wonder why.
In particular. But
Yeah.
so they have a lot of coverage. There are some Blue Cross Blue Shield plans, United healthcare plans that cover. So it's been really interesting, and it changes every year, and that's one of the most annoying things. However, it seems to be changing that more and more insurances are covering
it.
Yeah.
Wow, that is absolutely
it's been great.
phenomenal.
Yeah.
I would have, I'm just sitting there going, I've always heard, I've known you, and I knew Patrick, Dr. Patrick, and I always said I'd rather just go to him, but I knew, my insurance really didn't cover that kind of stuff, so it's like out of pocket, and not that it's not worth it, but sometimes you got to choose keep your lights on or pay your mortgage or that kind of stuff. So all right, wow. I'm kind of blown away that that whole world is right there. So, okay. So now I've watched it, my people have watched this show and they're like, okay, great. Now how do we get hold of you?
Yeah. So there's a couple different ways, right? So in this day and age, social media is huge. Yeah. So we're on Instagram and we're on Facebook.
Total millennial. What did she say first? We're on Instagram.
We're on Instagram. Yeah.
Immediately with the Instagram, not Facebook, not Twitter.
We do a lot more on Facebook.
Do you really?
Yeah, more.
But you're a millennial, so the first thing is that Instagram.
Instagram, yeah, that's a big one, especially for photos, because so many people want to see what we do.
Yes.
So that's a big part of it.
Okay.
Yeah, so we've started doing the newsletters and blogging and some of that stuff, which has been fun. Again, something else we learned in this strange 6-month period of time. But so Facebook, White Crane Clinic. We have 2 locations, so you can find 2 different Facebook pages.
1 word or 2 words?
White Crane Clinic, so it'll be 3 words.
3 words all together or spaces?
They'll be spaced out.
Okay.
Yep.
The right way.
Yep, the right way. Yep. So you'll see it. So we're on that a lot, and like Trinity Chat and all of those things.
Oh, you're on Trinity Chat. Okay.
Oh, yeah. And then not me so much, but I'm not good at that. But and then we have a website.
You're millennial and you're not good at it?
I know. I'm actually the youngest maybe in my office besides the front desk staff. And I don't do it because I'm not very good at that.
That's funny.
Yeah.
That's awesome.
I am the one who responds to most of the Facebook messages. I do that.
But you're in, okay, so let's talk about where you're at in Tarpon real quick.
Yes.
So are you still downtown?
We are still downtown in the Ellis building.
I know exactly where that place is.
Yeah, we've been there for 34 years. Yeah, so we're still in the Ellis building.
Okay.
We are talking about changing that office space because it's upstairs.
Right.
Which has been what's so nice about having the new Port Richey office, which is right on 54 near Rowan and Mill Pond, because that is a first floor. So we have patients who will drive between the 2.
Okay.
But so we're in both those locations. We're in Tarpon Monday through Thursday, and we have Monday evening hours. And then we're in New Port Richey Tuesdays and Thursdays, and we have evenings on Tuesdays. So we try to offer some flexible timing for patients if they need it too.
Okay. And then on Fridays, you got to have your downtime. Don't call her on Fridays.
That's okay. Fridays, I'm usually doing emails. We do
Catching
all kinds of stuff.
up,
networking things. 3 kids.
3 kids.
3 kids. So.
I remember when she was this, and she was just a kid, and now she's got 3 of them. Yeah. Oh my God! Congratulations.
Thank you. So we do a lot.
It's so in hours of the days.
Yeah, so we're there 10 to 4, but then our evening hours, Mondays and Tuesdays, 10 to 7.
Okay.
So the last appointment is 6:30.
Nice.
Yeah, so we try to do that.
Faded out type of thing.
Yeah.
It's a lot of work, isn't it?
It's a lot, yeah, but I love what I do. I'm very blessed.
Yeah.
I mean, let's be honest, I get to stick people with needles, so it's not the worst thing.
So we were talking about, she was like, I gotta stop saying this because I really like, saying poke. I shoot people professionally.
Right.
I mean, and I said that once in public, and people went, I'm like, TV cameras, not shooting guns. So, So let me ask you this: we got about 3 minutes left.
Sure.
Something that would surprise people about Doc Stephanie.
Ooh.
I do this to everybody, so I just want to, because everybody wants to because it's a know-like feel. Mm-hmm. So if they know something about you, like, oh, that's kind of cool.
I graduated from acupuncture school really young. So I've actually been doing this for 6 years now. I started college really young.
Yeah, you did. Well, you were
did.
smart.
Thank
This
you.
whole family, I'm going to tell you right now, off the chart smart. I'm just telling you. And your brother is like he's not an idiot, but idiot savant. I mean, he gets.
I like the idiot part.
Oh, hey, don't make fun of Jordan. He was, even as a young kid, he was just like mind-blowingly smart. And all of you were.
Mm-hmm.
But it just
Very
I'm
different,
sitting there
too.
going, wow.
Yeah, so we're really lucky. So we
No
all
dumb
started.
kids.
No, we all started college at 15. So acupuncture school takes 7 years.
Yeah.
And so I did 7 years. So when I graduated 22, it was kind of odd for people to say, "Really, a doctor?" It's like, yeah,
years
it's been, So it's been great. So I've been doing this for 6 years now. So a long time.
That's awesome.
Feels like, but
And you trained in my personal profession, our opinion. You trained one of the smartest dudes I know. Me and your dad would go, "Hey, this hurts. Yeah, come here just a second." And he would do it, and you're like, "Whoa, hey, well, I don't know what you did, but that's good."
yeah, he's incredible. I've been so blessed to be able to take over practice from him. I mean, that's mind blowing, but he takes the time to even sit and go over patients. And we spend time monthly together, really going through, because again, they call it a practice, which I don't always love when but that's any physician. They call it a practice. Are you practicing medicine? You know, you're like, yes, but that's an awful way to say it. So he's been doing this for such a long time. So I'm truly blessed to have him, and he's with me. So he's been able to really train me. Now I have such a larger scope of practice. I'm able to do Korean acupuncture. I mean, I believe I'm the 9th person in the United States who does that.
Really?
Yes.
You're
So
in top 10.
yeah, look at me.
Look at
so
there.
it's pretty incredible. So I'm very blessed and very fortunate.
That
And
is
growing up
awesome.
in this community, I'm lucky too, just to
That's
be
good.
here.
So if you're on social media, you're on Facebook, Instagram, you do Twitter at all?
No.
Yeah, I think that's dying out. I'm just
I
saying.
hope so.
And you have a beautiful website, right?
thank
Then
you,
the
yeah.
phone number was up there. So if you're in pain, and you don't want to go the traditional way, not saying it's not traditional, because it depends on where you live. It's all perspective. Call Doc up. She'll take good care of you. She's young, but you know what? She learned from the best, and that's the way it is. If you're really good at what you do and you learn from the best, you're on top of your game. Thank you for watching. We know you have a lot of stuff to watch on the web and all that kind of fun stuff, but we appreciate you being with us. We'll see everybody on the next show of A Focus on Business.